Welcome to Talking Dentures, where Simon answers all your questions about dentures.
Hello guys, this is a good one because this is from Sore Spot Simon. It's funny because my name's Simon and I deal with a lot of sore spots. So, what do dentists do if dentures are rubbing? I can't speak for dentists because I'm a clinical dental technician, so what I do from a dentist may be slightly different because I'm always looking at dentures from a functional aspect, right from creating them in the laboratory to function properly to the point where they're going in the mouth. Now, when dentists adjust sore spots, a lot of dentists find it really difficult to do the adjustment because they didn't make the denture. So dentists, they do it a little bit differently because they're not looking at it from the denture construction point of view all the way through to the fitting point of view. So I do training videos on this for dentists, trying to explain to them the process of creating the denture so they understand better how to fix any issues that they then have in that situation where they're fitting a new denture and it's rubbing, because it's not always straightforward. The way that it works is, if you imagine you've got a plastic denture which is a hard material and is sat up against your soft tissues, every time you bite, that denture is going to push into those soft tissues and pinch. And the most common reason for that is that our soft tissues in our mouth are different thicknesses. So in some areas, the tissue's like really thick. It's like a couple of millimetres thick. In other areas, it could be less than a millimetre thick towards between the denture and the bone. And so the soft tissue in that area is going to get pinched. So there's no reliable way of making a denture without that sometimes happening. The thin tissues can't compress as much as the thicker tissues. I'm talking about skin tissue. So as the soft tissue compresses under the pressure when you're biting together, it's fine, but where it's really thin, that's where it pinches, and that's where we then do the adjustments on the denture and we just take a little bit off. That's the most common cause of dentures rubbing in, I would say, probably about 40 to 50% of cases. So that leaves 50 to 60% of cases that isn't the issue. And the issue may be that the denture's overextended. And that one's a little bit more tricky for a dentist to sometimes diagnose, but not always. I'd say it's the next one, which is, you know, they might look at it and go, oh, it's pressing in where it shouldn't, it's a little bit bigger, and they might look at it through experience and then understand and reduce those extensions down so that the denture doesn't press into the soft tissues too much. But another issue which is not as common, or I say it's not as common, but I think is not diagnosed or picked up as readily as the other two issues, and that is the bite of the denture. So it's where the teeth meet, and the reason for that is it's not always obvious that the bite's causing the problem. So if you imagine you've got a denture in and the teeth on one side are too long, so that the teeth on the other side are not quite touching, when you bite, what's going to happen is that denture is going to press in that side more and cause it to rub. So there's nothing wrong with the fit of the denture. It's the teeth. Now, the problem is, if you think it's the fit of the denture and you trim some off of the fit of the denture and you put it in, if those teeth are too long, you're just going to make that problem worse, because now the denture's not fitting where it should be, but the bite issue is still there and you're not correcting it. So now you've got a denture that doesn't fit properly, and it's going to be more unstable and it's going to cause more problems. But that one is usually pretty easy to spot, because you can look at it and you go, oh, teeth are touching, let's just reduce that down and fix the problem. But it's more nuanced than that. Sometimes what happens, you bite this side, and what it does, it displaces the denture by pushing it to the other side of the arch. So now you get an ulcer on this side, and the dentist might look at it and go, oh, I think the denture's fitting properly, so they might have put a wash on there to pick it up, see if it's fitting properly. Probably not. But they think it's the bite, so then they adjust the bite, so they might trim some of the teeth off, but actually the problem isn't with the bite this side, it's the other side, and they take some of the teeth off. Now they've made it worse again. So adjusting dentures like that can be really, really difficult, and getting rid of those sore spots. And very, very frequently I see this sort of situation, patients coming into my clinic with dentures that they've had made, they're brand new dentures, they've only had them for a couple of months, a couple of weeks sometimes, and the dentist has adjusted them multiple times, and I look at it and I put it in, and I can usually see what's happened and why the dentists have done what they've done. I can understand the frustrations of the patient that, oh, these dentures have never fit, they've never been any good, and it's usually because the dentures have not been adjusted correctly. It's a really tricky one. All I can say in these sort of situations, if you can find yourself a clinical dental technician like myself, who've got the full experience of not just fitting dentures for patients and taking all the impressions and all that sort of side that we do in the clinic, but somebody that has the experience of actually working in the laboratory, creating the dentures, we're going to have a better understanding and equipment of how to adjust that denture. So when I make a new denture, I use what we call an articulator. I don't know of many dentists, I know a couple that use articulators. Typically it's a piece of equipment that we use in the laboratory that simulates the jaw motion. So they go up and down, and a really good one will also, it will mimic the jaw rotation as well. So when your jaw moves to the side, it doesn't just move sideways, it sort of swings on an arc. So a really good articulator will mimic that for us in the laboratory, where we can fine tune and tweak those teeth, but we don't see them being used in the clinic by dentists. So in those sort of situations, I think all dentists should have one. If you're making dentures, you should have an articulator, and it needs to be the same articulator that the lab's using, so that the models can be transferred from one to the other. And putting them on an Artic, this is what I'll do in clinic. If something's not quite right, I'll just pop them back on the Artic, and then I'll have a little look, I'll do the movements, and I'll see where I think the problem is, and I'll make the adjustments. Sometimes it's simple and I can see it straight away in the mouth, but this is just through using an articulator and being able to see everything on the bench, how the teeth are functioning together and working together. I can see it, and working like that for years and understanding the morphology of the teeth and how they lock together and how they balance and things like that, to then see it in the mouth, I think makes it easy for me to spot it really quickly and easily and see where the issue is, and correct it. So the question was, what do dentists do if dentures are rubbing? So that's what we do. We tweak it with a motor, and we just take little bits off usually, and that's usually all that's needed. If a denture's been made properly and the impressions have been taken really well and the bite has been registered really well and everything's gone to plan, then it's just a few little tweaks and we can get the dentures fitting properly. I'd say the only difference really in terms of the equipment between the clinical dental technician and the dentist is we use articulators, so that gives us a little bit more insight to what's going on, but we also use micromotors, which is like a handheld motor drill that we use for adjusting, whereas the dentists typically use the drill that they use in the mouth, which are not really suitable for adjusting dentures. Kudos to them for using them, because I've tried and they're really difficult. They vibrate and they've got no torque to them, so as soon as you start trimming, the motor slows down, and it's just really, really difficult to adjust the denture with one of those. So yeah, my advice would be, if you've got a denture and the dentist hasn't been able to do the adjustments properly and you're having lots of problems, is find a clinical dental technician like myself that will take a slightly different approach to fixing those problems for you. Hope you found that useful, guys. See you in the next one.
Thanks for watching, and don't forget to send us your questions. There's a link in the description below. Bye!